Welcome back. It's time for our Africa Health Network report. Linord Moudou is on assignment. Now, the parasites that cause malaria have perplexed scientists for generations. Conventional treatments that rely on multiple drugs are effective, but only until the parasites develop a resistance to them. In Africa, malaria accounts for the majority of deaths. Linord Moudou has more.
Researchers at the University of Cape Town have developed a single-dose anti-malarial drug. They say the treatment kills the female mosquito that causes malaria instantly, potentially charting a new path in the eradication of malaria. At the core of the drug is a molecular compound from the aminopyridine class, codenamed MMV 390-048. The scientists say that in animal models, the compound has disrupted the malaria parasite's life cycle, effectively killing it and curing its host of the disease. Researchers say the treatment will also prevent person-to-person transmission of the parasites through contaminated blood. The university's Drug Discovery and Development Center and Swiss-based Medicines for Malaria venture, MMV, collaborated to test the compound on animals. Lead researcher Professor Kelly Chibale says the results were remarkable.
The main difference between this molecule that we've discovered in comparison to drugs or medicines that are on the market already are basically at two levels. Firstly, unlike existing medicines that are available on the market, when tested in the same animal model or experiments, what we found was that this molecule we've discovered is far superior in terms of actually curing animals infected with the malaria parasite just with a single low dose of the drug.
The World Health Organization says malaria killed about 655,000 people worldwide in 2010. The majority of the victims in sub-Saharan Africa are children under age 5. Symptoms of malaria include fever, vomiting, and muscle pain. If left untreated, the disease leads to the breakdown of organs and death. Besides the huge human cost imposed on the African continent, the mosquito-borne disease is an economic burden, draining public and private resources and hampering productivity. The research team spent 18 months testing the molecules on mice, and Professor Chibale says during that time, the parasites showed no signs of developing resistance to the compound.
What we then did was to go through a process to confirm whether what we saw from this high-throughput screening campaign of 40,000 molecules. To prove that what we found was not false, we undertook a process we call heat validation. And this is just a process where we remake, we characterize by techniques that we know to confirm that this molecule is real. We check the purity, and then we retest on the parasite, and we retest on normal cells. And then that allowed us to confirm that what we saw from this high-throughput screening campaign was genuine.
The MMV Expert Scientific Advisory Committee has selected the compound for preclinical development, a first for research conducted on African soil. Professor Lucille Blomberg, Deputy Director at South Africa's National Institute for Communicable Diseases, says she's thrilled and optimistic about the new drug.
I think it's a hugely significant find that this drug has been identified from an African research program, and I think UCT needs to be congratulated. It's a new class of drugs, so cross-resistance with existing malaria drugs to which the parasite may develop resistance at some time is not going to be a problem. So I think that's particularly important. And it seems to be a very potent drug.
The anti-malarial drug still must pass further testing that will include clinical trials on humans, which may take more than 5 years. But the researchers are confident the discovery will reach the market and transform lives. Linord Moudou, VOA's Africa Health Network.
And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.